Hi everyone, welcome back in today's video. So in this tutorial I am going to show you the best technique in which you can cannulate a vein so that you can administer a drug safely and effectively. So in this tutorial I am going to show you how to do IV cannulation. So the procedure is very simple. Before you start the procedure, make sure you are supposed to follow the following steps. The first step is you have to gather all the necessary equipment. For example, you may need IV cannula that is 22 gauge. So you will need the IV cannula. Then you will need strapping. So this is strapping for you to dress the cannula. So you will need strapping. You will also need an alcohol swab. So this is an alcohol swab. This is an alcohol swab. You will need it for you to rub and to clean the vein. Okay, you will also need a cotton wool for you to apply pressure on the area where you have given the shot. You will need a syringe for you to flush the cannula or for you to push the IV medication. Okay, you will also need a water for injection for you to flush the cannula or for you to reconstitute the drug that you are going to administer to the patient. Okay, you will need a disposable gloves. You will need a disposable gloves for you to use as a TNQ. Okay, step 2. You have to start by introducing yourself to the patient. For example, hi, my name is Dr. Daoud. I'm going to perform IV cannulation. Are you ready?
Yes.
Yes. So the patient should be consent before you start the procedure. So you have to gain consent first. Then the patient should be in a comfortable position so that you are able to insert the IV cannula safely without any painful method. Okay, let us start now. The first step you are supposed to do is you have to apply a TNQ. So you apply a TNQ first. So when you apply the TNQ, you have to palpate the vein first. So you palpate the vein. You palpate the vein so that the vein will be very visible for you to insert the IV cannulation. Then what you are supposed to do is you get an alcohol swab. So you get an alcohol swab, then you start cleaning the vein. So you start cleaning the vein first before you start inserting the IV cannula directly into the vein. Okay, then what you are supposed to do, you get the IV cannulation, and so you get the IV cannula and you remove it from its manufacturer's packaging. So you prepare the cannula first. So you prepare the IV cannula. What you are supposed to do is you have to remove the cap of the needle. So you remove the cap of the needle. Then what you are supposed to do is you can leave this one or you can remove the IV cap. So the cap. So you can remove the IV cannula cap or you can leave it like that. So you can open it or you can leave it there like that. So before you start injecting the vein, you have to hold the cannula like this. So you have to hold the cannula like this so that you are able to insert the vein and smoothly without any interruption, and the patient will not feel any pain. So whenever you're injecting, you have to insert 15-degree angle. You have to insert 15-degree angle into the vein. Then when you insert the needle into the vein, you observe, you will see a flashback on the hub, on the chamber of the cannula. Then when you see flashback, you pull back the needle and you advance the cannula deep into the vein and you remove the needle. You attach the cap at the end of the cannula. You remove the TNQ and you can administer the drug safely like that. Okay, tip. The tips and tricks you are supposed to apply when you are doing IV cannulation is you have to ensure that you have selected the best and suitable vein for you to cannulate. Then when you're injecting, make sure your fingers should be around the vein so that you are able to retract back the skin, so because it will not disturb you. So when you're injecting, make sure you hold the hand of the patient and carefully so that you are able to insert the cannula safely like that. Okay, what you are supposed to do is how you are going to do IV cannulation. So you insert. So you will observe the first flashback. So this is the first flashback. So when you see the primary flashback, so you will observe the primary flashback. You will see a primary flashback in the jump of the cannula when you insert the needle into the vein. Then what you are supposed to do is you have to pull back the needle slowly so that you will see the second flashback. This is how you are going to do. So you hold here. I hope you can see this is the second flashback. So when you see the second flashback, then you can also pull back the needle slowly. Then what you're supposed to do is you have to advance the cannula deep into the vein slowly like that. So this is how you are going to insert the IV cannulation. Then what you're supposed to do is you have to remove the tinicle. You remove the tinicle. Then you open the lower lock end. You open this, then you apply your thumb on the tip where you have given, on the tip of the vein where you have inserted the needle. Then what you are supposed to do, you remove the needle. So you remove the needle. So this is how the needle looks like. So you remove the needle. Then what you're supposed to do is you have to attach the IV cap at the end of the cannula. So make sure you apply pressure here so that blood will not come out of the cannula, because you'll observe. So you have to apply pressure on the tip of the vein so that blood will not come outside of the cannula. Then what you are supposed to do, this is what you will observe when I release the pressure on the tip of the vein. You see blood is coming out. So you have to apply pressure like that to avoid blood coming out of the cannula without your order. Then you attach the cap of the cannula at the end. When you advance the cannula deep into the vein, then what you are supposed to do is you have to start dressing the cannula. So you dress the cannula by using a strapping. So you start dressing the cannula with strapping. So this is how you are going to dress the cannula. So you attach it like this. So you secure the cannula by dressing it with the strapping. Then what you are supposed to do is you have to start flushing the cannula. So you get a syringe, you remove the syringe from the manufacturer's packaging. You also get a 21 gauge needle for you to withdraw the water for injection to flush the cannula. So this is a sterile water for injection in which you are supposed to flush the cannula. You open it, you withdraw the water for injection and start flushing the cannula. So you have to flush the cannula first before you start giving the drug if it is secure. So this is how you are going to flush the cannula. You insert the syringe deep into the cannula, then you flush it like this. So this is how you are going to flush the cannula. You apply pressure on the tip of the vein. Again, you remove the syringe and you attach the cap of the cannula at the end. So this is how you are going to secure the cannula. So we shall move into the IV drug reconstitution. So thanks for your watching and have a nice day.